The information on aging better in uncertain times is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
Medical cannabis. What exactly is it? How much do you require? Does it really work? Which applications should be made to the treatments you may require with the health issues that you have? Hi folks, I'm Gord Martineau and welcome to another in our continuing series of Aging Better in Uncertain Times. People are asking more and more about medical cannabis because they're considering medical cannabis as possibly an alternative to the medications they're currently taking and possibly in the future when they may require certain medications. Joining us today, Dr. Hence Clark. Dr. Clark is the Director of Pain Services and the Pain Research Unit at Toronto General Hospital. He's very well known internationally in medical circles. He's addressed conferences on medical issues many times internationally, even speaking to the full House of Commons. Dr. Clark, welcome today.
Morning, Gord. Pleasure to be here.
Thank you. And so what are your views on, let's say, medical cannabis as an alternative to opioids? Now, the opioid crisis, as you know, has destroyed families and taken many lives. It of epidemic proportions. So do you see medical cannabis as an alternative to opioids?
So, Gord, there's a lot there. That's a pretty complex question. And I know you, myself, and Fabio discussed this quite some time ago. When we're looking at our opioid crisis, and as you know, 80% of those that are overdosing or having fatalities as a result of the opioid crisis are typically consuming illicit opioids and or co-administering other medications or alcohol, benzodiazepines, etc. And so when you look at the cannabis or medical cannabis as a potential to help with some of the reduction in your opioid use or to treat specific conditions, there certainly is a signal there towards it being able to do that. Will it be useful for everyone? Probably not. And we're really working hard to get the science and the data to support those it will help. We have many patients that we've seen reductions in their opioid use with appropriate help from their practitioners in terms of integrating this into their regimen, certainly.
Well, this leads into another question, and you kind of touched on it there at the end of your answer. Is it possible to use medical cannabis in concert with medications or opioids that people are currently taking? Can you blend both with the eventual aim of weaning people off opioids, which are highly addictive, as you know?
Right. And I want to touch on something you said early, Gord, which was as an alternative to their medication. The one thing I want to caution your viewers about is experimenting on their own, starting a cannabis product and stopping the medications they're on. We're seeing some of that happening, and that's not a sound plan for one, from a safety perspective. And you've been on some medications for some time for a reason. If you have the appropriate guidance and we can introduce this product into some of your regimens, absolutely we can move towards reducing your benzodiazepines, reducing your opioids. What is cannabis? It is an ultimate central nervous system depressant. And most of the medications we use in pain, for multiple chronic conditions are exactly that. So it makes sense that you can add something and help reduce another, but that has to be really done in concert with your physician.
Let me bring in Aras Azadian into this discussion. You probably know Aras. He's utilized his extensive experience in senior management in both financial and biotechnology sectors. Now, Aras founded Avicana, and the view that he has is a vision toward establishing a biopharmaceutical company with a strict focus on medical cannabis and the applications of such. Aras, thank you very much for joining us today.
Thanks for having me. It's a pleasure to be here.
Now, you know Dr. Clark, and do you? I'm supposing that because of your studies and his studies as well in pain management, lead you to perhaps the fact that medical cannabis could be used as an alternative to opioids.
So on our end, our focus is more so on ensuring that we can provide standardized medicine in the form of cannabis or in the form of cannabinoids as essentially a toolkit for physicians like Dr. Clark, to provide them with what we call a formulary so that they could as Dr. Clark was mentioning, potentially include these products in the regimen of patients for particular unmet needs. For us, we're a bit more broad, where it's more general than just chronic pain, but we're certainly seeing efficacy in, at least from an anecdotal level, from patients that are leveraging off of these products for particular ailments, and in some cases, I imagine that may have the benefit of weaning off opioids. But I leave that part of the discussion to the physicians. Our job is just to make sure that we give them the toolkit.
Now, I know that you're intensively involved in research studies, and you've done very many of them. What are the conclusions that you've obtained so far? What have the studies revealed?
So considering that this industry is in very, very early stages, the earlier studies and the earlier work we did as an R&D company has been, again, on focusing on delivering the cannabinoids in a more consistent, stable, and more accurate way. And a lot of the studies were focused on that, is delivering the products, whether it's a topical for dermatology or it's a oral or sublingual for systemic absorption. So we've gone through the process of delivering these products and have effectively demonstrated that we can deliver safe and effective. Studies we're enrolled now are much more focused on actually demonstrating the efficacy and the potential that these specific products have in particular comorbidities, symptom clusters, or actual clinical indications. And as Dr. Clark mentioned earlier, we're starting to see positive signals in the areas including chronic pain, but we're seeing it in other areas, again, including dermatology. So there's, I think, a lot of utility that we're going to be able to demonstrate over the short term. And I believe on the medical or pharmaceutical side, the benefits of cannabis are still relatively in very early stages, but we're starting to see a very positive trend towards efficacy in very specific things.
Dr. Clark, how soon do you envision the kind of everyday applications of medical cannabis? I mean, are we talking imminent, or are we looking at 2, 3, 4 years down the road? Any kind of estimate as to when we can conclusively say it is an alternative to opioids?
So, Gord, we're kind of stuck in Canada. And the reason we're stuck as a country is, at the advent of recreationally approving cannabis for various, tax issues, etc., anyone can purchase a product at almost any corner store. And they're now, we have about 3.7 million Canadians, 10% of the population, that have said, we're willing or we're using cannabis on a daily basis to self-manage, self-medicate for various conditions, whether it's anxiety, whether it's sleep, whether it's pain, whether it's depression. And because this industry hasn't taken the road of being a biopharmaceutical company, there are a couple of them out there. Erasmus company is one of them, but we do not yet have a product that Health Canada will allow us to put into a randomized controlled trial. So, myself, there are many other senior researchers across the country that have these protocols sitting without a product to test. Meanwhile, the population can go out and test themselves by using these products. And so, we're moving towards closing that gap. And I think, what we have decided to do while we wait for that is do more observational, real-world evidence type trials with the products that we currently have. And so, I'm going to speak a little bit about the UHN and the Shoppers Drug Mart partnership, where we're now looking at 2,000 patients that are being enrolled long-term for those 4 conditions I just mentioned: pain, sleep, anxiety, and depression. And what we're going to do is actually track them based on the products they're currently consuming via our study portal. And so there are about 11 companies. Avicanna is one of them on that portal, but all of these companies have at least gone the step of ensuring that what is on the bottle matches what is in the bottle, or those products have been validated and reliable in terms of ensuring if patients are finding value in these, we can then move it forward and they can be sure that that product is actually what they will be using long term. And believe it or not, 9 years into this industry, this is a first. And so when we're done with this, we will have the data that everyone's asking for in terms of what those inputs are that they're consuming and what that end result looks like, and try to connect some of those dots, hoping that we can get to the next level of doing these randomized controlled trials that are the gold standard that the CMAJ wants to see, all these journals want to see. But so it's already in use. The actual definitive evidence is not going to happen tomorrow, but we need to help our public move forward in terms of figuring this out.
I think it's very important to explain to the listeners, and I completely agree with everything Dr. Clark just said, that cannabis is legalized, and I think it's important to understand really the segment. Today, as Dr. Clark mentioned, you can go into a dispensary and you can buy flour, you can buy pre-rolls, you can buy a lot of these products. A lot of people were originally using it for what we used to call recreational use. We're calling adult use Now you're starting to see a lot of different segments of the population that are self-medicating, and they're buying these products for what we can call wellness. But there is also medical products that are in the market. Now, these medical products are supposed to be more accurate. They're supposed to be more controlled. And in many cases, I believe they are. And these physicians are authorizing patients to buy products, but physicians are not able to specifically specify exactly what dose, what product to buy. They're just giving patients access to medical cannabis. And it's a bit of a danger area, because then a patient feels like that they're authorized from a physician to use any type of cannabis product, and then they're going out there and they're buying potentially a high THC product without having the right dosing or the right titration. So I think the challenge here is that medical cannabis, adult use or recreational cannabis, is legal. People are using these products, whether they're self-medicating or they're using it for wellness or mood enhancement. But going towards what would be a prescription medicine that could be accurately dosed by physicians is the next challenge. And unfortunately, Health Canada, while we're permitted to sell these products, is not permitting us to go into what Dr. Clark would call a gold standard, double-blinded, placebo sort of clinical trial, because they're asking us to go through full clinical development in advance, right? So there's a bit of a complexity there to get to the point that these products can be registered as actual drugs. But I do see progress. And to Dr. Clark's point, there is these real-world evidence observational studies that allows us to at least get more data on the products that are in the market.
So let's bring in our in-house medical expert, and that is Dr. Fabio Varlese. Dr. Varlese is the chief of medicine at Runnymede Hospital. He has extensive experience as well in geriatric medical applications. Dr. Varlese, you've looked at the medical cannabis as an alternative to current treatments. What are your opinions on it, and what do you tell your clients as if they're asking you these questions?
Well, certainly in the aging population, medical cannabis is becoming very popular. With geriatrics, we're dealing with a population that has a huge history of comorbidities. They're already on 10, 15, 20 drugs for multiple medical conditions. And continuously, we receive patients that are asking about medical cannabis, and many of them have the perception that it is the alternative to many of the other standardized drugs that they're using every day. Now, while theoretically this is definitely something that has huge potential, and as our guests have been saying continuously, that medical cannabis still needs to go through a lot of research. It needs, we have products, medical products out there that haven't been standardized. There's an assumption in the general public that medical cannabis has the characteristics of a pill, but pills are much more defined. There's a molecule that has an action mechanism, and it works in a specific area, perhaps in the brain, in other areas, in other organs. Medical cannabis, the product is much more complex. The way it's manufactured is absolutely different, and therefore we're dealing with a lot of sort of uncertainties, and hence there is the need to undergo all of these studies. And we, put things in perspective for patients. A lot of doctors today are not well versed in medical cannabis, and there's many, many courses that doctors are going through in the various universities just to get a better understanding. Many of them have to refer to specialized pain clinics, but we try to put things in perspective for our patients.
Dr. Clark, one of the challenges, as you well know, is figuring out the dosage that a person must take in order to address their specific ailment. The weight of the person, their age, their condition. How do you go about suggesting, or overcoming, the challenges that exist when you look at a patient? You go, okay, how much of a dosage do we require for this person? How do you do that?
Gord, it's a great question. I just want to, before I answer that, I just want to touch on what Fabio mentioned in terms of the knowledge required
Sure.
to actually guide patients and the limitations to that in the existing physician kind of landscape. And so I have recently become a member of the Canadian Investigation for the Consortium for the Investigation for Cannabinoids in Canada, and that we have worked on about a 2.5 year continuing medical education module for those physicians that are interested. They know they have patients that may benefit and they don't know how to start. And so we've put together the top basic scientists across the world, actually, to create this education module for physicians. And so with that, we then move into, okay, how do we dose this? And so, how do we actually get a patient to a place where they either see benefit or they don't? And so, we just finished a trial that I think is important, where we enrolled about 1,000 patients across Ontario. This was ongoing for about 3 or 4 years, and it was just published in the Canadian Journal of Anesthesia. And what we found were that about the 757 patients that started the journey and went down the road of using a cannabis product or a cannabinoid medicine product, that at 6 months, 1/3 of them were still using the product. And so when you look at that number, clearly there is a signal there. Show me any drug that, Fabio or myself or a physician starts on a patient where you get more than a 30% uptake and you probably have a wonder drug. So there's a signal there. How do we dose this? And so this is where the difference in the cannabis products today compared to the pills that Fabio are talking about, there is a real difference. If I were to prescribe something where it has gone through all of the preclinical data, I could say, here's the starting dose, here's how we increase. With these medical cannabis products, it's very important that the patient and the physician have patience, okay? Because we actually have to do this slowly, ensure we don't see those psychological and the psychotropic effects that everyone's worried about. CBD may be helpful for some people, but quite often if you're dealing with a pain condition, you may need some amount of THC as part of dealing with whatever those symptoms are that you're trying to treat. And so over time, you start low, you build slowly. We have now published some guidelines in terms of how you would even implement these products in terms of opioid weaning. So that was published in late last year, if not early January of this year. And we have another one that should be forthcoming in terms of integrating this into a chronic pain population. So it's out there. It's just a matter of getting that information to more physicians. And that is one of the barriers to patients accessing these medications for sure.
Ras, you've looked at this situation, and do you as well, experiment with how much THC you can blend with CBD as an effective treatment for something? I mean, is this an avenue you pursue?
So absolutely, on the preclinical side or even on the clinical side, we are always trying to identify what is the appropriate dose, but what is also the appropriate ratio. There is particular clinical pathologies that we believe high CBD without THC has efficacy, but to Dr. Clark's point, you often need some ratio of THC for a lot of these comorbidities or a lot of these clinical indications that we're targeting. And what's important on the dosing side is to actually provide an accurately dosed product. So making sure that per spray, per pill, per drop, you know exactly what that dose is. And again, the challenge in the industry has been companies trying to be everything to everyone. So recreational focused companies also selling medical cannabis creates several conflicts there, because on the recreational side, people are looking for high THC products. While on the medical side, having offerings where you do have different ratios, again, will give the physicians the formulary or the toolkit that they could start with something lighter. They can start with something that has a lower dose of THC and titrate up. So again, the mix between, I think, the recreational and the medical segments within the industry have made it complex. But there is groups such as us that are out there trying to identify the most appropriate ratios for the clinical pathologies, but also to ensure that we're giving at least accurately dosed product to the physicians so they could go through that experience. And like Dr. Clark said, a patient slow experience in which they can titrate up and ensure that they have a consistent product every time.
Dr. Varlesi, I mean, when you speak to your clients, your patients, and they question you about medical cannabis, they may say to you, look, I'm not here to get high, okay? I don't want the psychoactive ingredient in any medical treatments that I take. Do you try to allay those fears and say, look, this is not going to affect you in that manner, or how do you set their fears aside and say it's okay? If you've got a blend of THC and CBD, it's okay to take this.
So most of the reasons why we see patients in geriatrics tend to be for symptom management, and many of our patients suffer from depression, anxiety, insomnia, issues related to appetite, etc. So we carefully look at the product to see if we could match with the specific need they have. And that is a decision that, as mentioned before, is very much dependent on the knowledge of the clinician. And as I said before, many clinicians are still, really getting to learn the complex world of medical cannabis, to be honest, because up until a couple of years ago, it wasn't even part of the regular training of doctors. And now I'm hoping to see more and more of it in their standardized and core curriculum. And as mentioned by Hans, there's new programs, educational programs for them. So really, we look at the patient. Every patient is unique. Every patient has specific needs and many times very complex medical backgrounds. And we try to tailor the specific product to their need. And we're always cautious, obviously, about the percentage of THC, which is the psychoactive component of medical cannabis, and we look at products that take that into consideration. But it is a very delicate process because they may be on already medications such as antidepressants, tranquilizers, antipsychotics, all sorts of medications that are already managing these symptoms. So it is a very complex situation whenever we are considering medical cannabis for our patients.
Dr. Clark, do you experiment, do you experience any level of frustration? And I know your studies are ongoing and you'd like to be able to take another step forward in your research and then bring the applications to market, as it were. Are you encountering any kind of slowness or trepidation on the part of the federal authorities in the studies that you're doing or the experiments you're doing?
Gord, I live in the world of frustration right now. I can tell you that there is no doubt things are moving much slower than we would like. When we look at what we think is coming next, and hopefully we do think there are changes coming to these limitations that have pretty much handcuffed an industry that has been created, but not given us the ability to actually do the science needed to, move this forward. And so there are so many misconceptions. We are dealing with generational misconceptions. And one of the things when you hear, Dr. Varlesi speak is, not an important concept for the listenership is that not all cannabis is weed. And we still have this association that if you're consuming cannabis, you're consuming a joint that will make you high. And that all comes back to the amount of THC in the compositions of these products. And so we all know there are thresholds. I often say, Dr. Varlesi spoke about tranquilizers or antipsychotics. If I were to give someone 30 milligrams of Haldol, which is quite commonly used at 2 milligrams or 3 milligrams, they would be floridly psychotic, even though it's an antipsychotic. And so, when we think about what we're doing with this molecule, we're at the ground stages here of figuring out what those thresholds are, what the lowest amounts are, as we do with most medications before you tip over into the side effects. And so understanding that it's a process, it is certainly something that has been around for decades, and patients have been talking about this for decades. We just need the help to move the science forward. And unfortunately, we're a bit handcuffed right now. And so we hope that's changing. I will share with you, when we did a quick overview of patients coming in for arthroplasty in our institutions here at UHN. And 1 in 5 individuals, when we surveyed 600 patients that came in for their knee or hip arthroplasty, said we are using cannabis for our osteoarthritic pain. Let's think about that. So, now we ask them, what product are you using? 1/3 of them didn't know what product they were using. 1/3 of them didn't actually get it from a licensed, regulated format, which would enable you to get it in the mail. So we have 1/5 of patients treating a serious medical condition, and many of your patients out there will have osteoarthritis that are listening to this. And the first thing I would tell them is please head down the path of trying to get a product that has been validated and reliable, and then move from there in terms of how you integrate it into your regimen. We look at what has happened in terms of how much people are spending on cannabis in this country. In 2018, it was $40 million a month. At the start of COVID, it jumped to $140 million a month. We are now over $200 million a month being purchased by this country on cannabis-based medicines, of which maybe 1/3 of that is the legal framework to do so. So we've got a long way to go to get reputable products being consumed by our patients and actually having the individuals follow them so they can do this safely.
Okay, so Aras, when you talk to people about, okay, I'm involved in this or that type of research and this kind of biopharmaceutical study, do you remind them, hey, we're talking about various applications here. This is not a situation where you have to imbibe in combustible cannabis. I mean, there are creams, there are pills, there are lotions. Do you explain all of it?
To Dr. Clark's point, first we were facing the stigma of cannabis, and I think today the stigma of cannabis is that all cannabis is the same. So it's evolved a bit, but we do have to explain. And when we're looking at these specific clinical pathologies, if we're looking at dermatology, it's a cream. If we're looking at, localized pain or even osteoarthritis, it's a deep tissue gel. When we're looking at different applications that are either neurological or even pain related, we're looking at, again, oral or sublingual. So none of our formulations and none of our products or any of our studies are related to inhalation. We have 0 inhalation products because our focus is delivering cannabinoids in a specific way for a specific clinical indication. And I think, again, that's what we've done is we've created that formulary for physicians that will feel more comfortable.
Similarly, Dr. Berlese, I mean, you have clients coming to you and saying, look, I'm not going to smoke a joint, okay? I'm not going to do that. I mean, do you try to settle them down and say, look, you don't have to. There are so many different ways of taking medical cannabis.
That's so true. We deal with the stigma all the time, and this has been a very interesting process over the past few years. I would say that our patients come in very cautiously, asking the questions. Many of them would love to ask, get into details about the use. Many of them don't disclose that they're using, which makes it much more complicated for us when we're managing their various symptoms and medical conditions. I really suggest that all physicians should start being a bit more proactive in the questioning, because, as mentioned before, many of them may be making use of products through dispensaries. These are not medically, medical products, and therefore it becomes very, very difficult to deal and to manage patients that don't disclose or are not open enough to talk about it. So we need to really dig deep when we're doing our history taking, and then bring them on the path of proper use. We spend a lot of time educating, counseling them, talking about it, just so that we could put it better in perspective for them. They make many assumptions. They go on the internet. They read resources that perhaps are not accurate many times, and there's a lot of managing that happens, without any disclosure with their trusted clinicians. So clinicians need to do a better job digging into their histories and understanding, so that they come forward and feel more comfortable talking about it. A lot depends on us, Gordon.
Right. All right, gentlemen, thank you very much for your input today. I know I learned a few things, and I'm hoping that people watching and listening to this, paying attention to our podcast, have learned something as well. Aras Azadian, the founder of Avicana, Dr. Hans Clark of Pain Management Clinic at Toronto General Hospital, And Dr. Fabio Verlese of the Toronto Clinic, thank you so much for your input today. And we'll see you again soon, I hope.